Employers have long been at the forefront of this struggle for affordable health care.
There are lessons. Most of the topics you heard described today have a mirror image in public policy and the current discussion.
We really like this model, and the reason why we offer 2 different HSA accounts is because we really like to think of it as that long-term way of financing healthcare for those people who choose it. We need to surround that HSA with those tools for success for our team members to make sure that they have what they need to make those good consumer-based health decisions.
So reference pricing for knee, hip, and joint replacement has helped reduce our costs without a reduction in quality or patient satisfaction, as well as addressing the dramatic cost variation that we see in California among hospitals.
Many other companies or carriers, insurance companies, create retrospective bundles where after the fact you determine what the total cost should have been. But this is a prospective bundles. This was about creating a scenario for the provider that would say, look, we're just gonna say we're gonna pay this amount.
But at the surface, it's really pretty simple. We incentivize our employees to elect one of these ACOs. They go get their care in this integrated healthcare system. They get most of their care, 95+%, maybe more. And that will drive volume and revenue to that particular hospital system, integrated hospital system. And in return for that, they're willing to guarantee and take risk and guarantee financial trend for us over time.
But if you had 1 or 2 things that you think ought to happen at the federal level that would make it easier for you and your companies.
Providing a competitive marketplace that focuses on the appropriateness of the care that's delivered, so that there are market forces that come to bear, there is transparency that allows us to understand the differences, and that it's focused on making sure that the care that's delivered is the right care and that no harm is done to the patient.
I would support giving us a little bit more flexibility in how preventative care is defined. And then the other thing that we'd love to see is we have a lot of veterans who work for Wells Fargo, and it's because many of them are covered under TRICARE or utilize VA for care. They are not eligible to contribute to an HSA.
Driving towards pay for value is critical to the longevity, I think, of the system. And another key element that folks mentioned, the transparency, enabling our employees to fully understand cost and quality.
The lesson going forward for us is we have a job to do for the American people, and it's not a Republican or a Democrat. It needs to be done by both sides and both houses working together.